It is my great pleasure and honor to be with you here in this important meeting and discussion, and looking forward, to take further whatever recommendations that will come from today's meeting and discussions, as well as other earlier discussions on this important agenda item. Dear brother, Dr. Tedros, Your Excellencies, distinguished colleagues, good afternoon, good evening to you all. World Tuberculosis Day 2023 is of a particular significance as the United Nations General Assembly's second high-level meeting on tuberculosis is coming up in less than 6 months, specifically on 22nd September 2023. At that meeting, I'm sure countries will report back on progress and challenges on the road towards our end TB goals that have been set long time ago, the SDG agenda, and the implementation of the political declaration from the last high-level meeting that was held in 2018. And here I expect that member states from the Eastern Mediterranean region, as well as other regions, will be proud to represent themselves at this high-level meeting and report back on whatever progress that they managed to make. We all know, despite the different challenges that we are all facing at different levels in IMRO and beyond. I can think here on that important meeting, to go ahead with that, on 3 critical points where I hope we will see progress from now until we go to that important meeting. Point number 1, we are lagging behind, unfortunately, in the areas of prevention. And giving numbers globally, only 42% of the 30 million people targeted in 2022. I'm sorry, Teresa, can you hear me?
Yes, we can hear you clearly. Please go ahead.
Very good. Someone came to my office and told me that they cannot hear you. So thank you. I'm glad for that. Thank you, Hala. So I'm sorry for the interruption. Globally, only 42% of the 30 million people targeted in 2022 benefited from preventative treatment. And unfortunately, in the Eastern Mediterranean region, we are not even at a quarter of those eligible for such service. We have untapped, potential to reduce transmission in those who could benefit from this intervention, including children and people living with HIV. We need to intensify the prevention efforts, which are among the most effective public health interventions, as we all know and agree. As we prepare for that high-level meeting, I would encourage countries to report back on the number of the people they put on preventive treatment and to think of ways that we could make more progress on that area. Second point that I'd like us to share, we continue to fall short of mobilizing sufficient financial resources for our TB response. Globally, again, less than half of the 2018 commitment target has been achieved. And in our Eastern Mediterranean region, less than half of the funding comes from domestic resources, which indicates, a prevailing dependency on external donors, putting us in that sort of type of challenge when it comes into maintaining and sustaining, or having sustainable funds. Without sufficient sustained national financial commitment, countries cannot provide the care that is needed and expected from them, including to those who are most vulnerable. We need to continue support our countries so that they increase their financial commitment in an efficient, integrative health system strengthening approach. To get ready for September meeting this year, I would just like to encourage our countries also to document their domestic financial TB program contributions and to propose plans on how they could be increased by different ways. And then my final point on that, as TB is a social disease that thrives on poverty and malnutrition, countries need the whole of society approach, a multi-sectoral approach. As we keep hear this word from Dr. Tedros since the beginning of the pandemic. And even that concept was there before, but during the pandemic, this sort of concept is real proof to us that we have to follow this sort of approach. Multi-sectoral, the whole of society, the whole of government approach. as I said, as just we did for COVID-19, in line with our regional vision here in IMRO, in fact, health for all by all. We have seen remarkable efforts and impact in introducing the TB multi-sectoral accountability framework in countries, including in those moving towards TB elimination. In preparation for that meeting also, it would be a major inspiration if countries would prepare good practice examples and success stories, highlighting how multi-sectoral approach and the whole of society approach have contributed, in fact, to improving TB care in their settings, to let others learn from these sort of success stories. Our work to end TB goes beyond these three elements. Definitely, I'm just sharing with you this, but it goes beyond these three elements. And I'm sure that we will hear about these sort of elements in this meeting today. But if we could seize the opportunity of the September meeting to make, progress on prevention, financial commitment, and multi-sectoral approach, that would amount to a massive setup, of our successes forward until we reach our, SDG targets by 2030. Most importantly, I'd like just to conclude by saying, yes, we can end TB. And I have no doubt of that if we come together, bring our wisdom, and have collective efforts on such important target. Thank you very much, Teresa, again, and it is my great pleasure and honor to be with you today in this meeting. Back to you.
Thank you very much, Dr. Ahmed. Thank you for your leadership and tireless work. And indeed, you are so right. We all understand our challenges, but we should also share more actively our best practices and exchange between the regions and the countries. And I would like also to highlight that under DG's first flagship initiative, support was provided to more than 100 countries, including 49 high-burden countries in all WHO regions. The WHO developed and consolidated new guidelines that allow to shorten 3-4 times of treatment of the most severe forms of drug-resistant TB. 2 new drugs and 12 diagnostics were recommended by WHO. All WHO recommended oral medicines for the treatment of drug-resistant TB in children have a child-friendly formulations commercially available. 109 countries are using WHO-recommended or oral new treatments for drug-resistant TB, and 26 out of 30 countries are using rapid molecular diagnostic tests. Child-friendly formulations are available in 74 countries, and new effective drugs and treatments in general are available due to the joint efforts of member states, WHO, partners as Stop TB Partnership, USAID, UNITAID, Global Fund, manufacturers, and civil society. This brings us indeed hope that we can and must end TB. Thank you very much, Dr. Ahmed.